If you're on Medicare, you have probably already heard the exciting news that broke last week that eligible beneficiaries can now get certain weight loss medications for just $50 a month through the Medicare GLP-1 Bridge Program. But now a new question has taken its place. Which medication should you choose? Today, we are comparing the 3 medications available through the Bridge program so that you'll better understand the differences before talking with your healthcare provider. Hi, everyone. Welcome back to Beyond the Scale, my GLP-1 journey. If you are new here, I am Stephanie, and I've been documenting my own Zepbound journey while researching the latest GLP-1 medications, Medicare updates, and obesity treatment news. Before we get started, I want to mention that I am not a doctor or healthcare professional. Nothing in this video is considered medical advice. My goal here is simply to explain the differences between these medications so that you have a more informed conversation with your healthcare provider about which option may be appropriate for you. Before comparing the medications, let's quickly review who this program is designed for. The Medicare GLP-1 Bridge Program currently runs through December 2027 and gives eligible beneficiaries access to select weight loss medications for a flat fee of $50 in a monthly copay. That is fantastic. Generally, you will need Medicare Part D coverage, prior authorization to meet the program's BMI requirements, and meet the medical eligibility criteria, such as obesity, being overweight with a qualifying health risk factor. If you would like a full breakdown of who qualifies and how the Bridge program works, I'll link my complete Medicare Bridge program video below. Okay, it's time to meet the 3 covered medications. Although people often refer to these as GLP-1 medications, one important detail is that Zepbound actually works a little differently. Wegovy and Foundayo primarily work by activating the GLP-1 receptor. Zepbound activates both the GLP-1 receptor and the GIP receptor, making it what's called a dual GIP-GLP-1 receptor agonist. For most patients, they're all considered medications used to help treat obesity, but they aren't identical. Option 1 is Wegovy. Wegovy contains semaglutide and has been available longer than the other medications that we're discussing today. Because of that, healthcare providers have years of experience prescribing it, and researchers have accumulated a tremendous amount of clinical data. Let's look at what some people like about Wegovy. First, it has one of the longest track records among weight loss medications. It has extensive research supporting its effectiveness. There are proven cardiovascular benefits for certain eligible patients, and it's available through the Bridge program in both injectable and oral forms. So if avoiding injections is important to you, having an oral option available may be something worth discussing with your healthcare provider. Things you'll want to consider, though: in clinical studies, semaglutide has produced significant weight loss. However, studies comparing semaglutide to Tirzepatide have found that Tirzepatide produced greater average weight loss. That does not mean every individual will have the same experience, but it's something many people ask about. Option 2 on the list is Zepbound. Unlike Wegovy, Zepbound works on 2 hormone receptors instead of 1 by activating both GIP and GLP-1 receptors. Let's talk about why some people like Zepbound. In clinical studies, it has produced the greatest average weight loss among the medications that we are discussing today. Many patients report strong appetite suppression, and it also improves blood sugar regulation. Some things you're going to want to consider with this: The Medicare Bridge Program currently only covers the KwickPen version of Zepbound. It's also important to remember that while clinical studies show greater average weight loss, more weight loss doesn't automatically make it the best medication for every person. Your medical history, side effects, other health conditions, and personal preferences all play an important role. Our third option is Foundayo. Foundayo is an oral medication, meaning there are no injections. What some people like about Foundayo, it is taken as a daily tablet. There are no needles. It is convenient for many people who travel frequently or simply prefer pills over injections. Things you're going to want to consider with this, because Foundayo is newer, it doesn't yet have the same amount of long-term, real-world experience as medications like Wegovy. That does not mean it isn't effective. It simply means healthcare providers have had less time using it in everyday practice. So rather than asking which medication is best, I think a better question is which medication may be the best fit for your situation. For example, you and your healthcare provider might lean toward Wegovy if having a medication with a long track record and extensive research is especially important to you. You might discuss Zepbound if maximizing weight loss is one of your treatment goals and if you're comfortable using an injectable medication. Or Foundayo may be worth discussing if avoiding injections is your highest priority and an oral medication fits your lifestyle. These aren't recommendations by any means. They are simply examples of the kinds of conversations you might have with your healthcare provider. Another question that I hear all the time is, do these medications have different side effects? The answer is that they actually have a lot in common here. Because all three medications work through the GLP-1 pathway, many of the most common side effects are very similar. These can include things like nausea, vomiting, diarrhea, constipation, stomach pain or discomfort, indigestion, and of course, a reduced appetite, which is part of how these medications help with the weight loss. So no surprises with these typical side effects. And the good news is that for many people, these side effects are temporary and they often improve as the body adjusts to the medication. That is one reason that healthcare providers usually increase the dose gradually instead of starting at the highest dose right away. It is also important to remember that everyone responds differently. Some people experience very few side effects, while others may need to slow down dose increases, switch medications, or maybe even decide that a particular treatment just is not the right fit. One medication is not automatically better or worse simply because someone had a great or a difficult experience with it. That's why your healthcare provider will look at your medical history, other medications that you're taking, and your treatment goals when helping you to decide which option may be the best fit for you. Now, one final reminder that I have for you is that although these medications are generally well tolerated, they can occasionally cause more serious side effects. You want to be certain that you read the medication guide that comes with your prescription and discuss the potential risks and benefits with your healthcare provider. And of course, seek medical attention right away if you experience symptoms that concern you. So what if you have type 2 diabetes? This is another area that can be confusing. The Medicare Bridge Program specifically covers medications for weight management. If your healthcare provider is treating type 2 diabetes, medications such as Ozempic or Mounjaro may instead be covered under your regular Medicare Part D prescription drug plan. Coverage, prior authorization requirements, and out-of-pocket costs depend on your individual Part D plan. So which one is right for you? After comparing all three medications, you may still be wondering, okay, but which one should I ask my doctor about? The truth is, there isn't a single medication that is right for everyone. Instead, I think about it this way. If having a medication with years of clinical experience and extensive research is important to you, Wegovy may be worth discussing with your healthcare provider. If your treatment goals include achieving as much weight loss as possible, your healthcare provider may want to discuss whether Zepbound is appropriate based on your medical history and individual needs. And if avoiding injections is your biggest priority, Foundayo may be a medication worth asking about, or also the Wegovy pill is another option there. Of course, those are just examples. The right medication depends on many factors, including your medical history, other health conditions you may have, whether you prefer a tablet or an injection, your weight loss goals, how you've responded to similar medications in the past, any side effects you've experienced, and, of course, your healthcare provider's clinical judgment. The exciting part is that Medicare beneficiaries now have multiple treatment options through the Bridge program. Just a short time ago, many people didn't have access to any weight loss medications through Medicare. Now, eligible beneficiaries have choices, making it much more likely that they can find a treatment that's a good fit for their individual needs. The goal isn't to find the best medication overall, it's to find the medication that's the best fit for you after a thoughtful conversation with your healthcare provider. And of course, you know I want to hear from you guys. If you're eligible for the Medicare Bridge program, which medication are you most interested in learning more about? Wegovy, Zepbound, or Foundayo? Let me know in the comments below. If you found this comparison to be helpful, please give the video a thumbs up because it really helps YouTube share it with more people who may benefit from this information. And if you'd like more Medicare updates, GLP-1 news and research, and honest updates from my own personal Zepbound journey, don't forget to subscribe. Thank you so much for watching this video today, and I'll see you in the next one.